Hey guys, welcome to my channel. My name's Idara. I'm a third year med student at UCSF. Just finished OBGYN, delivered a couple babies. Happy that I won't be delivering any more babies, and I'm starting on ophthalmology this week, which I am so excited for. I think that I want to be an ophthalmologist, so this week will be a really great career exploration. I'm doing retina clinic, which I'm excited about. I don't know that much about retina. Hopefully I get to use the indirect ophthalmoscope a little. Hopefully I get to see a couple laser procedures. I'm just really excited. I think I would have so much fun this week, so I'm going to take you along with me today, just studying, getting ready for tomorrow, and how I get set up for a work week, especially on a new rotation, because I like to go in with like a little bit of background, some context. I think for ophthalmology, I don't expect to be asked too many questions because you don't really learn ophthalmology in medical school. So it's not the same as going on to OBGYN, for example, where they do expect you to have a good amount of background knowledge. So before you go into rotation, you want to really read up, make sure you know your basics, make sure that when they ask you the questions about the basics, you can get those right. I don't expect to be asked questions like that for ophthalmology, but I do want some context because I want to be able to know what I'm seeing so that I can actually retain it. So I'm gonna prepare today, and then I'll take you along with me tomorrow too for my first day. So for my core rotations, I've done peds, surgery, just finished OBGYN, so I still have medicine, neurology, psychiatry, and anesthesiology left to go. So as much as I can, I like to just refresh, keep up with things. Right now I'm gonna review some psych, watch some online meta, do some flashcards, keep things fresh in my mind so that when I start the rotation, I don't have to do as much after work in terms of content review. And then also I'm taking step 1 and step 2 sometime next year. So I'm trying to be different, you know, like I'm a crammer and it doesn't actually work obviously for retention, and I'm trying to grow, you know, I'm trying to do things the right way because learning this content is important, you know, it's not college anymore where it's like, who cares if you don't really know how the plant cell works. I really need to know how things work now, so I'm trying to do my best to be my best. Hence, review. Getting into bed to study is always the worst idea. I'm so sleepy right now, but I'm so comfortable. I'm just gonna stay here. If I fall asleep, I fall asleep. Excuse the video quality. I thought it'd be cute to take a picture of my rotation site on my last day, and I dropped my phone and shattered the camera. So that was my Friday. But I just got my groceries in. It's 8 p.m. and I'm about to do my weekly cook. I got some pasta because I'll be making baked ziti. I got some breakfast stuff to make acai bowls. I'll be making butternut squash soup for lunch. And then I have some salad to go on the side with some meals. This is for the ziti, more breakfast thing. And then I'll be making grilled cheeses with ham and pesto as well. So I'm gonna get to cooking.
That looks incredible.
Thanks. Good morning. Working Monday. It is 7:55. I have a Zoom meeting with the course director at 8 a.m. Just go over the elective, go over our goals for the elective, and then I head over to clinic. Waking up this morning was so hard. I don't know why. I slept 7.5 hours, which is enough sleep for me. But I think because I did a lot yesterday, I don't always do a lot, so I just was super tired this morning, but I'm feeling better. I'm feeling excited. I have my SMART goals. By the end of the week, I want to be able to read and interpret an ophthalmology note because it's a different language. And then I want to be able to visualize the back of the eye. That's a fundoscopic exam, and then I want to be able to report my findings. So when they say like the disc should be a 0.3 ratio, like a cup to disc, I want to know what that really means. I'm not very good at ratios, so it should be a good week of learning. That was such an exciting meeting. I was a coordinator in my first year for the ophthalmology homeless clinic, and so through that I met a lot of preceptors, but at the same time I'm not really great at networking. I unfortunately am a very do-it-yourself person, and that doesn't really work. You know, you don't get very far by yourself. So this year I was thinking, okay, I need to start, you know, talking to more faculty, talking to more residents. But it was really nice because I was just talking with the clerkship director, and she was like, oh yeah, like we've met, I know you, we work together at the clinic. And it just made me happy that, you know, we were able to make a connection before and to remember it. I just wasn't sure what would happen, but that makes me happy, you know, that I made some connections even when I wasn't doing that good of a job making connections. So I'm excited this week to meet more faculty and more residents. You know that meme that's like when you drop your kid off at school versus after school? Why is that me right now? What happened? Okay, great. So what's the reason for your call today? So far this morning, I've had one in-person visit, one phone call visit, and right now I'm catching up on notes before the next visit, which is in 26 minutes. So hopefully this takes me like 20 minutes to do both of their notes, and then I can do the chart for the third patient before I meet them on video. Today has been good so far. I'm feeling more advanced, you know. Every time I come here every 2 weeks, unless I have vacation or week off, and lately every time that I come I feel a little bit more organized, more confident. I can take less notes during the visit and then remember enough to report to my preceptor and write the note later. So definitely feeling the growth. I'm in my second clinic now, getting ready for the afternoon patients. Right now I'm in an exam room. I just have a video camera and a phone here, and then because of COVID, the doctors are mostly working from home because they have the computers that allow them to video drop from home, whereas we don't, so we have to come in to access the network. So getting ready for this first visit right now, I'm just looking through the patient's problem list, which is everything that they've been diagnosed with, looking at what medications they're on. Okay, just sort of getting an idea for the patient's risk. And then I go to their notes and I try to figure out what they're being seen for, which isn't always obvious. Sometimes it's nice because they'll have called the call center and the call center will have written like, here are some symptoms that they're having. Looks like this patient's just calling for a routine checkup actually. So that's a straightforward conversation, and then I check and see if they're up to date on their immunizations, and this patient just needs a flu shot. Okay. So then I try to pre-populate my note a little bit, and that just means like pulling up the template, pulling up, you know, the reason for their visit, and then sometimes I will write down the questions that I will be asking so that as I go I can just quickly fill it in, and that makes my note a lot quicker to write on the back end. It's 5:13. My last patient was scheduled for 3:30, so the day just ended up going a little bit longer, which is fine. I'm totally fine with staying as late as makes sense for me to learn more. Growing as a third year means that I will not stay just to stay. I used to be like, oh, you said I can go home. Well, I don't know if I should go home. Like, do you really think I should go home? So I'm just gonna stay. No, I don't play that anymore. I'm like, I am paying to be here and I want to be here. So if there's more to learn, I will stay all night, sure. But if there isn't, I will go home. And so on a similar vein, I really try to be efficient and get home. But I have several more notes to do, so that sucks. Let's see what time I get out of here.